Hello everyone, I am Abhishek Khanal and you're watching VetstudybySAAT. So today we are here on the episode 3rd of case series, case presentation. So without further ado, I'd like to get into the case presentation. So today we have the third case of our series and it's a very simple case. So let's start with the history. So a 2-year-old intact male mixed breed dog living entirely outdoors in a rural area of Sicily, Italy, was evaluated because of a 2-day history of anorexia and lethargy. So the dog had been vaccinated only for rabies and was treated for internal parasites once as a puppy. So on physical examination, pyrexia of 104 degree Fahrenheit, that is a fever in case of dog, and petechial lesions, that is hemorrhage on the gingival mucosa, were observed. So there were no other abnormalities detected. So before jumping into the questions, let's discuss the significance of the history. Here it said that a 2-year-old, that means it rules out many of the disease that the dog gets while it is in immune compromised state, that is below 1 year old, and it is intact male. So there is a possibility of reproductive signs if there's a reproductive based disease. So, and there's a 2-day history of anorexia, and the vaccination status was just only for rabies. So we cannot rule out DHPPIL, that means distemper, hepatitis, parvo, leptospirosis. We cannot rule all those out. And it was treated for internal parasite just once as a puppy. So there is a chance of parasitic infestation as well. So there's a fever, and the most important history is there is petechial hemorrhage on the gingival mucosa. So what does that suggest? That suggests that there might be thrombocytopenia, that is decrease in platelets, or there might be vasculitis that is caused by majority of disease, the rickettsial disease and bacteria as well. For example, Leptospirosis causes vasculitis, Ehrlichiosis, hepatogenosis causes vasculitis. So there's a chance. So now let's move on forward with the questions. So the questions are: what are the differential diagnoses for petechial lesions, the most important lesion, and what useful information could be obtained from a CBC, complete blood count, and antibody testing for which infectious disease would be indicated, and what are the limitations of these assays for establishing a diagnosis. So, but the first question, the differential diagnosis for petechial hemorrhage, it can be caused by thrombocytopenia. As I stated earlier, it is the decrease in number of platelets in the blood, or thrombocytopathy. And in this case, the petechial lesions were associated with fever. So, therefore, an infectious or inflammatory etiology is most likely in this dog. There must be inflammation, there must be infection, or there might have been vasculitis. So, Ehrlichia canis, Anaplasma platis, Leptospirosis, Rickettsia species and like Rocky Mountain spotted fever, or any other species. And you can add hepatogen canis as well. So these are the differentials that causes petechial lesions. So what useful information could be obtained from CBC? So as we have already stated that a CBC can indeed confirm is there the presence of thrombocytopenia, that is decrease in platelets or not. So the mean platelet volume can be increased in dogs with primary or secondary immune-mediated thrombocytopenia. So in these kinds of disease, what generally happens is the immune system of the dog's body is very active. So there is increased secretion of globulins, that is immunoglobulins increases the amount of globulins. So there's nothing for the globulins to bind, and hence it creates a temporary state of autoimmunity. What happens is the globulins bind to the platelets, and there is autoimmune destruction of the platelets, that is immune-mediated thrombocytopenia. So that probably might have occurred in this kind of disease. So another thing to add, if the thrombocytopenia is accompanied by non-regenerative anemia and neutropenia, bone marrow suppression is likely. That means in case of chronic Ehrlichia canis infection, there is bone marrow suppression. So what is non-regenerative anemia? So non-regenerative anemia means the kind of anemia in which bone marrow is not responsive, that is, it is not producing any more blood cells. So in regenerative anemia in CBC, what happens is the number of reticulocytes increases. Reticulocytes is an immature RBC. So what happens is, if there is no reticulocytes, then we can conclude that bone marrow is not forming new RBCs. So there is no reticulocytes and it is non-regenerative. So evaluation of blood smear can show inclusion bodies in circulating platelets and a plasma platelets, or it might be mononuclear, that means Ehrlichia canis. So then a CBC was done, and then the following results were obtained. There was thrombocytopenia, there was mild non-regenerative anemia, and there was neutropenia as well. So on blood smear examination, morula-like cytoplasmic bodies were obtained, first in the mononuclear cells, this is the one, and also in the platelets there were some morula-like bodies. So we have two questions, two basics, one to finalize our case presentation. So what is the diagnosis? The diagnosis is acute Ehrlichia canis and anaplasma platelets co-infection. So because we got the morula of both of the organisms, we can conclude this diagnosis. So the presence of both agents was also confirmed by blood PCR. PCR was done, the genetic material was amplified, and then it was detected. And acute E. canis infection typically causes hemostatic disorders, while anaplasma platelets usually only induces thrombocytopenia with minimal clinical signs. So if there was sole infection of anaplasma platelets, there would have been thrombocytopenia, but minimal clinical signs. But the co-infection can worsen the severity of the disease. Like in this case, there is hemorrhage in the gingival mucosa, and in Ehrlichia infection, some of the dogs, most probably German Shepherds, because it is also known as tracker dog disease, because it was first detected in German Shepherd. In German Shepherd, it can lead to nasal bleeding, which is known as epistaxis, because the blood vessels in the nasal mucosa are very thin, so the thrombocytopenia can affect the nasal blood vessels. So moving on to the next question, how should the dog be treated? The simple answer is doxycycline. It is a tetracycline group of antibiotics which is lipid soluble. So it has a good spectrum for intracellular organisms. So that's why, as Ehrlichia and anaplasma both are intracellular, one resides within the platelets and another within the mononuclear cells, doxycycline is a very good drug of choice. The dose rate is 10 mg per kg once a day per oral, but if you half the dose, you can give it to BID, you can give it twice a day. So early treatment is very good. If the diagnosis is early, the treatment is early, it's very good. And it is generally the treatment extends up to 21 days, 2 to 4 weeks. So but the duration of the treatment depends on the CBC findings. Basically what we do in our clinics is that we start the therapy of doxycycline, then we check the blood for a week, then we check the blood again on second week and third week, and if the platelets have started increasing and if the normal parameters are back, then we decrease the duration of the drug, and if it has not improved, we go with alternative therapies, we go with additional therapies along with doxycycline. So the alternate treatment I was talking about was the second point, imidocarb dipropionate. It is an antiparasitic drug that is effective against E. canis or babesiosis or hepatozoon canis, and it is a very good alternative, but you have to be sure about the side effects. Its side effects are anticholinergic action like increased salivation, and it also causes drooling of saliva, nasal discharge, diarrhea might occur. So pre-treatment with atropine is very necessary, and you can also see pain at injection site with imidocarb dipropionate. So another drug might be fluoroquinolones, but it's not effective against Ehrlichia. It is only effective against anaplasmosis. So here another drug, glucocorticoid, is also indicated in dogs only, not in cats, because when cats are treated with steroids, it causes immune suppression and it cannot eliminate the infection. So it may be indicated. Glucocorticoid is only indicated when the thrombocytopenia, I've already stated, decrease in platelets is life-threatening. The platelets have decreased so much that it is life-threatening. In that case, if the platelet destruction is immune-mediated, then glucocorticoids are a very good option to suppress the immunity and decrease the destruction of platelets. But the therapy is done before the diagnosis has been made, before the blood reports have came. Immediate therapy, we can use glucocorticoids to if we suspect immune-mediated platelets destruction, then we can give it. So the next drug is androgenic steroids, that is oxymethylone or nandrolone, that stimulates the bone marrow production in chronically affected dogs, especially in those cases where I've already stated that this infection is characterized by non-regenerative anemia. So the mechanism of action is not clear, but it has been theorized that androgenic steroids increases erythropoietin hormone from the kidneys, which in turn stimulates the hematopoietic progenitor cells, and hence the bone marrow is stimulated. So here are the dose rates of all the drugs I've stated: doxycycline, imidocarb, prednisone, oxymethylone, and nandrolone. So you can have a brief look at that, and you can look at the duration of action, intervals, route of administration. So finally, let's move on to this photo. Here, there is the petechial hemorrhage in the conjunctiva of dog's eye, and also the fibrin is seen in the anterior chamber of the eye. This is the case of dog infected with acute case of E. canis. And next, on fundoscopic examination, the clear retinal hemorrhage is seen in a dog with thrombocytopenia owing to acute E. canis infection. So these are two typical eye lesions that might occur in case of Ehrlichia canis. That's all, and thank you for watching Vet Study by SAAT, and please do subscribe our channel and help us grow this channel together. And please stay tuned every Thursday for such interesting case series, and thank you.